Hi everyone, it's Dr. Erica Dickie here with Black Creek Mobile Veterinary Services. As promised, I wanted to do a full review of the Assisi Loop with you and how things have been going with my porter who I've been treating. So first, I'd like to start with an overview of arthritis in both dogs and cats. Arthritis is a condition that many pets have where basically the joints are no longer functioning as smoothly as possible to bend and flex, and it becomes some bone on bone contact where that's really uncomfortable for pets. So the cartilage is damaged and it's no longer sliding well. This can happen in all of the pet's joints, and quite frequently does happen in many joints at once. Usually around 7 years of age for cats is when you can start to see those changes. And dogs, it can happen at any time. So what was I doing for Porter? When Porter turned 7, he was not showing any signs of arthritis in cats, which we'll get to in just a moment. But I decided that I wanted to start some preventative care for him. What I did was I put him on a diet that had green lip mussel in it that acts as a natural anti-inflammatory. As well, I started him on a supplement that he would get daily as a chew. So it was like a treat for him. And that had glucosamine in it, chondroitin sulfate in it, and it also had devil's claw in it, which is a natural anti-inflammatory as well. So those were the kind of basic preventative measures that I took. And then recently, when he was about 11 years of age or so, and now he's 12, I started to notice some mobility changes in cats. Now, cats are really different than dogs in that dogs with arthritis, they tend to show those signs. It could be either a specific limp that you notice when they're walking around, or you can notice as well that they're having some stiffness when they walk, as well as difficulty rising from a rested position, or trouble going up and down stairs, or even a reluctance to go up and down stairs. So those are the most common signs of arthritis that you see with dogs. Whereas cats, it's so much more subtle. And it can be really challenging to pick up on, actually. So for me, as a veterinarian and having that knowledge in hand, I was always kind of closely watching for these subtle changes with Porter. So what I first started noticing is that there were some poops outside of the litter box. Now, this could be related to mobility issues, but can be related to other issues as well. So I was keeping my eye on that. It wasn't happening that frequently. The other thing that I started to notice was more hesitancy with him when he went to jump up to a higher height. Before, he would just do the jump with no hesitancy, would just be like, here, I want to jump up here I go. And so there was the hesitancy. And then I was also noticing when he was on the height, instead of doing his leap off and down onto the floor, he would use his paws, creep down first, and then do his jump so that he was minimizing that impact for him when he was jumping. And then the last thing that really said to me, okay, I need to start working on doing something more for him, was when he comes up the stairs, which he always likes to do when I go up the stairs. And of course, get on your fumble on your feet, so you kind of stumble on the stairs, which is always fun. But he started to miss some steps, and I could hear more fumbling on the stairs for him. So with all of those signs in mind, I began doing an injectable joint supplement called Cartrifim. This is off-label in cats, but it's used commonly in dogs, and it also helps to kind of rebuild and stabilize the joint at the level of the joint. And I do actually notice improvement on that, which has been great. At the same time, then I decided after the loading doses of Cartrifin and he was on to maintenance, I began using the Assisi Loop for his arthritis. Now, on his physical exam, where I noticed the most kind of pain and stiffness was in his back end, mostly on his lower back, over his hips, and then also in his knees. So that's kind of where I was aiming on getting the treatment. This was my first time using the Assisi Loop, actually. I had learned about it in my hospice and palliative care certification course, but I'd never had the opportunity to use it. So I thought, this is perfect. Let me get this experience under my belt so I can make the recommendation more confidently to all of my clients. So I went and I thought I would order the 10 centimeter loop. There's two sizes, 10 centimeter, and then the 20 centimeter loop is this size. So, but I didn't really have any experience again to know that in retrospect or hindsight, I would have preferred to have ordered the 20 centimeter for Porter, because then it would have covered a larger area for him. And yes, this does look huge, but on a cat, you know, this can very comfortably cover both of his hips and his knees. Whereas when I'm getting this treatment done with Porter, it's pretty limited. This one does still have its value, but for the most part moving forward, I would recommend the 20 centimeter loop over the 10 centimeter loop for most of my patients. Okay, so the Assisi Loop, what is it? This device is a targeted pulsed electromagnetic field therapy. And how it works is actually quite effectively. It enhances the body's own natural ability to fight against inflammation in the body. It does it on an intracellular level by increasing the nitric oxide production inside the cells that speeds healing of both soft tissue and hard tissue. So it has so many uses. It can be used for skin healing of wounds. It can be used for all musculoskeletal conditions because it affects bone, ligaments, and tendons. And it actually also has effects on organs. So if there's an internal organ that is inflamed, for example, pancreatitis is a very common internal organ that gets inflamed, the pancreas. And then anytime you have titus at the end of the word, that means inflammation of that organ. So pancreatitis is inflammation of the pancreas, and the Assisi Loop would be a perfect adjunctive therapy to work against fighting the inflammation naturally. Now, the benefits of using the loop are that it reduces pain and inflammation, which is our ultimate goal, of course. But it also improves mobility because, again, it's working against the arthritis that impairs mobility. It improves circulation to the level of where you need it to. And that's how it delivers the internal anti-inflammatory fighting abilities, which then promotes faster healing, reduces the need for pain medication, and the awesome benefit of it as well is that there's no dangerous side effects. So how does it work? Well, very simply, you just press this button right here, and then this device starts flashing green, and you know that it's on. There's no other way to know that it's on. It doesn't buzz, vibrate, or anything like that. So it's only the flashing green lights on this that lets you know it's on. And this one, this is the manual. So how it works is that it will deliver the therapy for an automatic 15 minutes and then shut off on its own, which is great. To improve the battery life in this, if you leave it for 2 hours on its own before you use another treatment, you can extend its use. Because what this loop is guaranteed to deliver is 150 treatments, and then anything beyond that is beneficial added bonus. It comes with a tracker sheet, so you can start tracking the treatments. Now for Porter, I began his therapy on October 5th. And I would do 4 treatments a day. That's the goal initially. So for acute inflammation or inflammatory conditions, you would treat 4 times a day for 2 weeks. And in acute conditions, you can see response from the therapy almost within the same or next day. It's quite fabulous that way. Whereas arthritis is more of a chronic condition, and chronic conditions require about 2 to 4 weeks of 4 times a day treatment before you can start to taper that down to to sorry, I just got a delivery. Before you can start to taper that down to either 3 times a day, 2 times a day, depending on how they're doing. So that's how I kept track of Porter. And you can see right here, this is where you reached the 150 the treatments, and Porter has well exceeded that. Currently, he's at 184, and we started him on October 5th, and we're now at January 13th. So what did I notice in terms of his improvement? I did notice some improvements. The poop accidents were gone. I wasn't notice him fumbling as much or stumbling as much on the stairs. I also noticed less hesitancy when he was jumping up, but he still has that slowly lowering his legs before he does that lower jump. I noticed the most difference after about 4 weeks of therapy, where I was really consistently giving his treatment 4 times a day. And then after that, when we started to taper, it was kind of holding him, but then whenever his cartrophin dose was due, I would notice some kind of improvements there because everything just works synergistically together. My next step for Porter would be to start using the 20 centimeter loop to target larger areas on his body, because I know that he's got arthritis in multiple locations, and the smaller loop here has only been treating really one joint at a time. The other alternative actually is an Assisi Loop lounge. And the Assisi Loop lounge is actually a mat that delivers the same technology, but it actually, when they're lying on it, it actually delivers that therapy to the entire body. So it's actually a total body therapy, which is fabulous. It's just expensive. And so I am saving up to make that purchase, but I do think that it would be worthwhile. The Assisi Loop Lounge has a guaranteed 6,000 treatments for it. And so it can be used numerous times for Porter and then any other pets that may be needing it down the road that I have. So I think that really covers a lot of what I wanted to share with you about this great technology that I include as a part of my integrative pain management approach to controlling pain in pets. But there were a couple other things that I wanted to mention, and that's that one of the challenges initially when I first started the therapy was getting Porter to remain still while I treated him. And in the beginning, he was kind of like moving all around, and I would just hold it and move it with him while I was petting him. Some things that you can do to enhance that treatment when you first start off is have it in a small room, keep the distractions minimal, turn off your phone, turn off the TV, focus all your attention on your pet. And in fact, they end up loving it because it's that special bonding time that you get to have with your pet, one-on-one, just you and them. I found personally that during his treatments, when I was really just dedicated to him and him alone, it actually helped me too, because we reconnected in our special time together. But also it was 15 minutes out of my day where I wasn't thinking about or dealing with all the other aspects of life. But that's the other thing, all the other aspects of life. 4 times treatment a day, that takes dedication, and that can be hard. And there were days where I only got 3 in, or I got 2 in, or there were days where I missed completely. And that's okay. That happens. That's life. You just continue on and move forward with the best that you can the next day. That's realities. I mean, things are crazy right now. People are working from home, dealing with all the stresses of COVID, our current and recent lockdown, staying at home, worried about family and friends, and just the state of the world right now. So I think the biggest thing is just doing what you can and knowing that whatever you can do is good enough. And anybody who takes on this as a rental or as a purchase, you're doing your pet a service to try and see if this is something that's going to make a difference for them. And the responses that I've had from the patients that I've used it on have all been very positive. How do you get the Assisi Loop is another thing I wanted to touch base on. It is a veterinary prescription only, so you can reach out to your veterinarian and ask for the prescription and then go online to get that from the distributor. The distributor in Canada, there's a couple. UXR is one that you can get directly as a non-veterinarian. There's other distributors, but those are veterinarian-based only. So you can purchase it directly from them, or you can purchase it from your veterinarian if they order it in for you specially, or like us, we have them in stock in our office. So again, it's Assisi Loop is the product. It is a targeted pulsed electromagnetic field therapy unit. It's all natural to help reduce pain and inflammation in your pet and really get them feeling a lot better and more comfortable. So for us, we offer it as a weekly rental so that you can use it at home, see if it's feasible in your daily life, see if you notice the difference in your pet, and then make decisions from there. You can continue it on as a weekly rental, or you can purchase the unit outright to have as your own and use as you need. What else did I want to say? And just to remember, when looking at arthritis cannot be cured. So when we work at doing these treatments, all of these different therapies, they all aim to manage the disease, but and make your pet as comfortable as possible. But the disease does progress as they get older. They start to develop more and more symptoms or signs of discomfort from the arthritis and the inflammation in their joints. And usually at some point, pets will need non-steroidal anti-inflammatories or other pain medications to manage that discomfort and keep them as comfortable as possible moving forward. But I mean, the other thing that's really good about this is that when you use this in conjunction with pain medications, you typically need a lower dose of the pain medications than you would if you didn't use this device altogether. They work synergistically, which is fabulous. So it's really a great non-pharmacological option to control pain in your pets, and you can do it at home, which is great. You don't need to go to the vet to get this treatment done. You are the one that controls it, and you are the one that has the power to help your pet feel as comfortable as possible. If you have any further questions about this device or your pet's condition or anything that we can do to help improve your pet's comfort, please don't hesitate to reach out. Our phone number is 226-779-KIND 5463. Or you can email us at wecare@bcmvs.ca. That stands for Black Creek Mobile Veterinary Services. And our website, petcomfortvet.com, has a lot of great information on there as well. Assisi Animal Health, the original maker of the Assisi Loop Lounge and the Assisi Loop, they have all the information on there, including the studies that they've used to show its effectiveness in our pets. You guys take care of yourselves, take care of your pets, be well, and stay safe. Thank you. Bye.